As infertility physicians, what has become a critical piece of what we do is education. We need to educate the public so people can understand what exactly it is that includes IVF care, what exactly it is that state and federal laws are questioning or protecting, because each and every one of us needs to get in this. Because I will tell you very honestly, those of us who have the most knowledge on the biology of eggs and embryos are not writing the laws. It is representatives, so we have to make sure that they actually represent us. We want to be a part of these conversations. We want to encourage our patients and the general public to appreciate that these laws that they're making impact real people who are doing this treatment to expand their capacity to have a family. And in that vein, I think as a person and as a citizen of this country, I will tell you how extraordinarily important it is for each and every one of us to vote. My name is Jennifer Hirshfeld-Cytron. My title is IVF Medical Director and Vice President of Fertility Centers of Illinois. Illinois' approach to fertility care benefits my patients in many, many, many ways. First and foremost is the fact that it's a priority. It's a priority because patients, when they receive care, mostly have coverage through their employer, which happened because people put through what's called the Illinois state mandate. We're one of maybe 20 states that has some degree of care. We tend to have more comprehensive care. That is only because the people of Illinois prioritize this. My advice for those trying to navigate the financial aspects of fertility treatment is to really come prepared. And what I mean by that is even in states where there are mandates to cover, each employer can still carve out what components they cover and what they don't. What is your copay? What is your coinsurance? What is your deductible? If you have a very high deductible, it doesn't even matter if something's covered. X number of dollars of your health care will be upon yourself. So come to that appointment having some sense. I talk to my insurance, I have a sense of what's covered. And then asking. Before you do treatment or testing, ask, has this been prior authorized? Is there an estimate of coverage? I think the best way is to come prepared and to ask before you partake in any type of testing or treatment to make sure prior authorizations are in place. If there's a sense of cost, if you can know that ahead of time. A key ability to access fertility treatment is knowing that it exists. It's upon each and every one of us, regardless of your role. If you have a friend or a colleague or a coworker that is interested in having a family, and they are either a same-sex male or female, single female, or heterosexual couple that's been unable to conceive, to let them know that treatments exist. So we have a wonderful website of fcionline.com that provides many ways to provide patient education. A key piece of addressing access to care is to encourage patients to inform their own employer about how the absence of coverage is impacting them. You need to tell your own human resources. You need to advocate for yourself. Selfishly, yes, it may not help you as much as it helps the person after you, but that's how we create change.